lately, right, there's a saying that, preventive medicines has been, gaining the importance over the last year. So how do you think that this is important for us to undergo health screening and take measure to modify and reduce the risk for developing, those chronic diseases and all that?
Yeah, because in the past, right, people were more focused on dealing with diseases after they came about, after you've been stricken by illness. But nowadays, we are more focused on preventing it before it happens.
Okay.
Because I think it's a more logical and smart approach. So which is why, the whole concept of, sugar-free came about so that you don't end up with diabetes.
Yes.
Yeah, and then the whole idea of, need to exercise is important so that you don't develop, other chronic diseases like hypertension and don't gain too much weight. So all these things mainly aimed at preventing illness. So in order to be able to prevent illness, of course, you have to take measures. You have to eat healthy, you have to exercise. But what is even more important is to have a progress report.
Okay.
Yeah, so like, in school, every year they give you, right?
Yes.
At the end of each term or semester, you get this progress report. Your teacher will say you did well or you did badly, or they will give you pointers to improve. So for your body, what is the way you're going to get a progress report? At the most, your family will say, hey, you look nice, you lost a lot of weight, you look good, you look fit. So, but that is very subjective. So you want something objective that helps you, have a proper progress report of your attempts to improve your lifestyle, correct?
Yes.
So the progress report can come in the form of your own assessment or professional assessment. So own assessment, things that you can do yourself, simple things like weighing yourself, measuring your BMI. Nowadays you get those scales which can even analyze your body fat.
Yes.
So you can get those if you can afford it, you get that. If not, at least a simple weighing scale. Yeah, and then calculating BMI, there's free calculators online.
Yes.
You can calculate. So at least with that, you can monitor your progress in terms of weight reduction. Simple things like that. Other things would be like, maybe measuring your overall health in terms of how often you fall ill. Like maybe 2 years ago when you didn't take care of yourself, you were falling ill 6 times a year. And then now you're exercising and you're eating healthier, you only fall ill like maybe twice a year. That's progress. But again, this is not really completely objective. So you want something truly objective, you need to go to the professionals. Like maybe a health screening center or to your family doctor. Like our clinic, we offer various different health screening packages from younger to much older age groups, and depending on the kind of lifestyle you're leading.
Okay.
So what we are aiming to find out is to see how your health is at this particular point in time, and in the last few months maybe, right? So some results give you an idea of how your health has been over the last maybe 3 to 4 months, and some results give you an idea of how your health is at this point. Some results can give you a projection of how your health is going to be in the next few years.
Okay.
So that's why the technology is advanced to the point that all these biomarkers are available now, and there are lots of interesting tests that we can do. It's the only limiting factors are your willingness to go through them and cost. So mainly these two. So if cost is not a major issue for you, I would suggest go for what you think is necessary. If cost is a concern, just let your doctor know, and we will take that into account. And most of us are honest and ethical enough to not push you to do things that you don't need. So we will advise you what you should do and what is meaningful for you. So if you do that, what you end up with is something called a health screening package, right? So depending on your age and your gender and your background profile, the kind of job that you do, the doctor will advise you to go through a particular package. And then when your results come back, it gives you like a progress report of how your health is or whatever you've done, whether it's working. No point doing the same thing if it's not working, correct? So there are patients who say, hey, but then I changed my diet, this is all I eat, I don't even eat so much, but the result comes out still bad. Maybe because you need to understand the fundamental thing that no one size fits all. So your body type may be totally different from someone else whom you know who tried the diet, and for you it may not work. So in order for you to understand how to take steps to amend and adjust the course of your training or your success, you need to do health screening regularly. For older patients, maybe it's not so much about maneuvering their life. It's more about figuring out whether they have anything major and dealing with the problems early, and keeping themselves healthy as long as possible. Because what matters more is having quality of life rather than the length of life. Correct? Yes. Yeah. So in that aspect, health screening is useful. If you ask me, I would advise start doing it when you're just 25.
Wow.
Yeah.
Okay. Then how frequent should you do? Like once a year?
Yeah. So like for example, if you're in your 20s, doing like at least some degree of health screening, basic health screening, things like checking your cholesterol, your sugars, your liver function, kidney function, thyroid function, and basic things like these, urine tests. You should do that at least 2 to 3 years once in your 20s, particularly if you're generally already leading a healthy lifestyle. But if you're already obese, or if you already feel that you're not healthy, you keep falling ill often, maybe you need to do a bit more frequently. But if once you hit about 30 to 35, you probably have to do it at least every 2 years, so that you have a better idea of how your health is. It would be better to do it yearly. But once you cross like maybe 40 to 45, normally we advise you to do yearly. Yeah, particularly if you have like very strong family history. And for certain tests, the guidelines are different. Actually, if you visit the MOH website on health screening, or if you look at this program called Screen for Life, which is a government initiative by the Singapore government and MOH, where they advise you to go for certain types of health screening at certain stages of your life. Like for example, colon cancer screening to do a stool test to check whether there's hidden bleeding, or going for cervical pap smears, or HPV DNA testing to see whether you have early cervical cancer. So all these things, there's particular guidelines on how frequent you should do it, but the difference is that those tests that they advocate are based on what we call population data. That means it's based on percentages of the population which are affected by these diseases. So it's more catered to the masses. But if you are looking at an individual level, right, you may not fall into that category. So if you wait for your letter to come in from Screen for Life to say that, hey, you have now 40, why don't you go check your for this, go for your mammogram, or go for your pap smear. Don't wait for that, because if you wait for that, then you're just trying to take preventive measures based on population data. But on an individual basis, your risk may be very different. If your particular family might have a very high risk of breast cancer, you should probably start earlier. So it really depends on your family history, your personal history, what kind of life you're leading. So health screening is definitely a good thing. It's just a question of how often you want to do it and whether your budget constraints allow you to, but you should do something about it.